28th batch captain so that they can introduce the team members of the opposition. So I would like to invite Shakya Veeratna to introduce their team members.
Good afternoon, everyone. I hope you can see me. Our team is the opposition team, and I'm the team captain, Shakya Veeratna. Our second speaker is Priyanjala Sumansekara, and our third speaker would be Pasindu, and our fourth speaker would be Tarisha Surya.
Thank you so much. So I would like to invite all the team members to keep their video on during the debate. So yeah, so let me just go over the rules. So each speaker will be given 4 minutes to present their argument in the first round. And then the captains will be getting 5 minutes for their rebuttal speeches. Yeah, and so we can move on to the debates. So I would like to introduce our judges for today. The first judge will be Dr. Pramodi Premaratna. She was the captain of the Musaeus College senior debate team in 2012 and 2013. So we would like to welcome her. And the second judge for today's debate will be Dr. Samarakon. So he's a senior lecturer in international studies at the Department of Social Sciences at the Open University of Sri Lanka. And the third judge for today's debate will be Dr. Chaminda Abesinghe. He's a senior lecturer at the Faculty of Social Sciences in the Department of International Studies, so in the University of Kelaniya. So without further ado, let's move on to the battle between the two teams. So first, I would like to invite the captain of the proposition to build the proposition base. Yeah. So let me check if I can hear you.
Yeah, am I audible?
Yeah, you're audible. Yeah, we can see you, and you can start whenever the timer turns green.
Okay. It is health that is real wealth, and not pieces of gold and silver, says Mahatma Gandhi. Hello everyone, as the proposing team captain, today I stand over here to put the basement for our argument on the topic globalization has a positive impact on the state-run healthcare system. First, we'll see what is globalization. The flow of information, goods, capital, and people across the political and economical boundaries. And now we'll see what is a state-run healthcare system. It is the healthcare system maintained by the government, and it includes hospitals, outpatient clinics, laboratories, pharmacies, and long-term care facilities. Now, to make my argument strong, I would like to bring some facts along with some instances. The first thing which I like to put forward is global partnership. Global partnerships are emerging both to provide great financial support to the health systems as well as non-financial support such as technical support and capacity building of health professionals. For example, the National Nephrology Specialist Hospital in Polonnaruwa, which was opened in the recent past, was constructed with the help of China, and it was built as a China-Sri Lanka Friendship Hospital. And this is just only one example, and there are so many. And now I'll come to my second point. The second point is about the distribution of pharmaceutical drugs, vaccines, and medical equipments. When it comes to Sri Lanka, around 85% of pharmaceutical products are imported, and according to data available, major sources of drugs are imported from India, Pakistan, USA, Switzerland, France, and some other countries. And also, you all might think, what is the connection of this? Here I go. In Sri Lanka, the speckled malaria history includes a massive epidemic in 1934 to 1935, in which over 1.5 million cases and 80,000 deaths were reported. If chloroquine was not imported, what would have happened to Sri Lankans? TB and also TB was high in early 20th century, and the BCG vaccination started in 1949, and the streptomycin was given to the affected people. If these were not invented and not imported, think of the situation. What would have happened? How did this become success? Yes, it's definitely because of globalization. And can the healthcare systems work without essential drugs, vaccines, and equipments? No, definitely they can't. And even in this globalized world, it took many days to bring the oxygen cylinders to Sri Lanka from our neighborhood, India. Then think of a situation without globalization. And my third point is technology. The technology has brought about a massive and welcome change to the healthcare industry. The patients now have access to some of the best diagnostic tools and new and cutting-edge treatments. The early detection of diseases has given an immense amount of support in improving the quality of healthcare system by reducing the severe complications caused by diseases. How these technologies developed? Globalization boosted them. All the innovations do not come from a specific country. So if globalization is not there, what will happen? These technologies won't be shared with other countries. As a result, healthcare system will move backward, and the facilities which we have now won't be there in our health sector, and people will lose their lives without even knowing why. And so don't you all understand that globalization is giving a positive impact on the healthcare system to ensure the treatments are available at the correct time to reduce the risk of mortality and to improve the quality of healthcare system? Thank you.
Thank you so much. So now that we have heard the base of the proposition, so we go to hear the argument of the opposition team. So it's over to you, to the captain of the opposition team. Yeah, we can't hear you yet.
Can you hear me?
Yeah, we can start when the timer turns green.
Okay. Good afternoon and greetings to everyone. We are the opposition team, and first of all, I'd like to explain to you about our base. Now, what is globalization? Like the previous speaker said, it is an integration of ideas, economies, policies, and cultures throughout the globe, right? So the main aim of globalization is to create what is called a global village, where the whole world shares these three factors: policies, cultures, and economies, right? And the main driving force behind globalization is the free market and capitalism. Now, when we come to the state-run healthcare system, this is run on a completely opposite policy, completely opposite both on economic and political spectrums. So the state-run healthcare system in Sri Lanka is a socialist welfare-run system. Right? It is a pro-poor state. I'm sorry, there's a lot of background noise here. It is a pro-poor state which promotes the provision of healthcare to the poorest of the people. And this is very important in a country like Sri Lanka, because we are, according to the WTO and the IMF, we are a country which is categorized as lower middle income. So we have a huge poor population who cannot afford healthcare in any other way. Right? And when we consider Sri Lanka, right, we are outperforming every other country in our region and every other country in what is called our economic group, the low middle income group, right? In fact, when we compare the indices like maternal mortality rate, child mortality rate, the life expectancy, right? When we consider all of this, we are actually on par with highly developed countries such as Saudi Arabia, Malaysia, Singapore, and even the US. Right? And how did this happen? Like, how did a country which is of low income, which has spent very little, only 2% of our GDP on healthcare, how is it outperforming all the other countries? This is because we have something unique. We have a unique healthcare system which is adapted to the situation in our country. We have, so the main base on this is the robust public healthcare system. We have PHIs, PHMs, public health officials, the MOH officers. These all act on the ground level to provide the basic care needed for our people. So we might not have what is called the most highest tech like robotics or gamma knives or anything like that. But we have what is unique to us. So this brings us to our main point. We are not advocating for isolationism like North Korea or Soviet Russia, right? We are advocating for localization. Localization is not globalization. Instead of creating a global village, we obtain the information from other countries, from combined research and all of these, and we create something unique to Sri Lanka. We create a healthcare system which is feasible for our economy, for our lifestyle, for our culture, right? And we integrate this into our healthcare system instead of going on the path of creating a global village, which is not sustainable considering where we are in the global scale. Thank you very much.
Thank you so much. So now that we have heard the basis of the arguments of both the teams, so let's move on to the second speaker of the proposition to see how they can further their argument and make it stronger.
Hello, everyone. Can you hear me properly?
Yeah, we can hear you. So you can start talking when the card turns green.
Very, very good evening, everyone. I'm Shiva, second speaker of the proposing team. So first, I would like to reply the opposition team captain about what he said. He said about global village and also about local system. And he said about using the researchers of the global and international things and making unique something to Sri Lanka. So how you can use the international researchers in Sri Lanka and make unique things in Sri Lanka? If you can use the international researchers, it means already you are using the globalization advancement. So just take that point. And also, I would like to say about the thing, he said, even with the 2% of GDP, we are managing somehow. And he said, so we don't need the globalization and local system is enough. I really want to say that we are receiving so much of help from the foreign countries to develop our health system. And these points will be discussed by my fellow members. So now I'm coming to my arguments. So I'm going to put forward my points under two main categories. One is awareness that we can bring into the population with the help of globalization and technologies. And here I would like to say, when it comes to globalization, the technological advancement is inevitable. So when it comes to awareness, of course, when you open the TV or open the Facebook or any of the social media, you can see so many times, hundreds of times, to hand sanitize and do all the safety measures for COVID. So how the people and the students or whoever, how they are receiving this kind of information very fastly and very frequently? It's because of the advancement of technology in Sri Lanka, and that is caused by globalization, of course. And I would like to say about the sharing of knowledge, research factors, and all the stuffs in the healthcare system, of course, in all other systems. So when it comes to postgraduate studies, when it comes to researchers, when it comes to medical experiences, of course, we are sharing all the knowledge with all of the countries in the world. Actually, alone is not strength. Being together is strength. So what I'm saying is, being together is the grace given by the globalization. So that is my point. And also, I want to ask a question to the opponent team. So in Sri Lanka, Western medicine is practiced as a prominent thing. So I want to ask how Western medicine came to Sri Lanka. It's because of globalization, of course. So that's the thing you have to consider. So without globalization, how can someone perform a Western medicine in Sri Lanka? So that's my question to you all. And also, I would like to put forward some points that are related to awareness. When it comes to awareness, reminding people of the precautions, safety measures, and what we should do, what we should not do, that is not possible by every PHI and every MOH persons to go to every home and say. It's only possible, it came only possible because of technological advancement that is given by globalization. So that is what we need now. And also, of course, there are so much of advancement in technologies that is related to strategical management in Sri Lankan healthcare system. Strategy is, and statistics and strategies are very much important in maintaining the healthcare system, which will say us about how the disease has been spread, how it is going on, and how it will go, and what the measures we have to take to prevent it. So these are the points, and I'm concluding my argument saying that, of course, globalization has a positive impact on state-run healthcare system. Thank you.
Thank you so much. So we are beginning to see the arguments of the proposition. So let's go to the next speaker of the opposition team so that we can see how they can strengthen their arguments as well.
Hi, can you hear me and see me as well?
Yeah, we can hear you and see you. So you can start as soon as the timers turn green.
Good evening, everybody. I'm going to ask you a question, a number of questions. How are you guys handling the pandemic? Are you able to go to the hospital if you have a stomachache? Or are you able to take your grandfather for a dialysis? It's the fear. We have a fear of getting the COVID and dying, right? So that's how negatively this whole pandemic has affected us, right? So this is Sri Lanka is a very good, has a very good health care system. And we, as a country, we don't have to think twice to go to a hospital because we won't be charged at all, right? That's how this state-run government is helping us all, okay? Because we are a developing country and we don't have the fear to go to hospital. But now it's come to a state where the hospitals are overcrowded, there are overpriced charges, and we don't have that kind of money to go to private hospitals and spend a fortune on that, right? So this COVID pandemic, talking about the COVID pandemic, it broke out in China. And there have been investigations showing that it was actually a bioweapon created by China to take over the world, because this is all a rat race. Everyone is trying to take over everyone. It's just a rat race. And because of this is a conspiracy to take over the world. And statistics have shown that China has increased. There have been positive numbers in Chinese things, but then economy has fallen down in the rest of the countries, right? So, talking about this, and the government has to spend an extra expenditure on the PPEs, the sanitizers, the extra protections that we need to have, and all other things. And that's just one pandemic that I'm talking about. I'm going to talk about another pandemic which will arise in the next 10 years or so, okay? So the multi-drug resistant organism, which is on the rise due to misuse of antibiotics, is has affected the health sector so much. And we can see this even now, it's emerging, okay? And this will be a greater pandemic than the COVID pandemic, because we're talking about multi-drug resistant organisms, a number of organisms which we call sepsis, and there will be no cure for this, no antibiotics, no vaccines, and it will put not only the state-run government system, health sector, but also the private sector, and it will also it could even end the human race, right? So I'm talking about that. And the first speaker of the proposing team talked about TB and all. So I would like to emphasize in the increase of re-emerging infectious diseases like TB. So TB was thought to have been eradicated in 1950s, but then it re-emerged in 1980s, okay? And talking about malaria in Sri Lanka. Malaria in Sri Lanka, WHO declared a malaria-free country in 2018. And again, it arose in 2020, right? So there have been over 2 million deaths when it came to TB. And in a country where, so most of the people are solely dependent, this has caused a huge number of things. And talking about the weakened state of the, weakened power of the state, the poor has become poorer and the rich has become richer, okay? So I'm going to prove this point with the incident which happened in 2017. Russia halted the import of tea from Sri Lanka because Sri Lanka didn't buy asbestos from Russia, right? So, but then Sri Lanka was forced to bring asbestosis as well because Russia had more power than Sri Lanka, right? Because it's a developed country and we're a developing country. So it put the lives, the health risk of many Sri Lankans, right? Due to respiratory diseases, asbestosis, it's all there. So like this, the developed countries have power over the developing countries. We have no control whatsoever. And talk about the vaccines and all, they don't come for free. Okay, so we have to pay a price. There is always a price to pay when it comes to that. Okay, right? And there's transmission now facilitated by travel, both human and animal migration, communicable and non-communicable diseases are spread really increasingly. And there are losing assets because of the whole COVID pandemic and people going abroad and everything. Thank you very much.
Yeah, thank you so much. So I can see that there's a fierce argument going on between both the teams. So now we can move on to the third speaker of the proposing team so that we can take a look at their arguments.
So am I visible and audible?
Yeah, we can see you and we can hear you. So you can start when the timer turns green.
Sure. So the thing about the thing about last time the opposition captain said right there, he just I'm going to just point out some false fallacies that in his argument, which would completely undermine his argument also. However, he first of all used a false dichotomy. He just used that Sri Lanka is kind of a socialist country, which he thinks it's opposite to capitalism, but it's not actually opposite to capitalism. It's actually a political stance. It's nothing to do with the free market. We all know that communist countries actually got deteriorated in the 1970s or 1960s. The USSR crashed. It's because of a communist. It's because of a communist economy. Here we have a capitalist economy. In our country, we are in this free market. Even though we are socialist, it doesn't mean that our economy is socialist. Our economy is part of the free market, every single part of it. So he just used a false dichotomy there, first of all. The second thing that he says that capitalism is part of globalization. Actually, that's not the case. Globalization is a completely different one. This is where he used a non sequitur, where his arguments doesn't follow the other one. The other one is Sri Lanka is not a communist country. Yeah, like a 10 Bush 4. It's nothing to do with the economic standards. And another one, he told that we are going to create a country which is like, which is unique to Sri Lanka. But that's not the case. For example, our argument is that globalization is the one which promotes promotes that thing. So even though we are using a unique one-to-unique, how can globalization be a negative one? It's a positive one. That's also a non-sequitur argument where he just doesn't follow the second argument, where regardless of globalization, he didn't talk anything about that. So there the argument is undermined. Next of all, the second speaker, while she was talking, she told that she used really hard composition fallacies. She only selected the bad stuff first, like, the asbestos problems. We couldn't meet the hospitals, but she completely undermined the other factors that really went into play. Like, we all of us are aware of it, aware of the pandemic, and death rates are much more lesser, which would be argued by some of our members. So I'll just mention some more points. Now let's consider a simple yet strong case study. Public statistics are clear reflections of state-run healthcare. Let's consider three main factors compounding USA and Sri Lanka. Comparing infant mortality rates, maternal mortality rates, and life expectancy of two globally contrasting countries, the statistics show almost same rates. But USA spends almost 10,000 on USD on per capita expenditure, while Sri Lanka only spends 157. So how are we just as same as the country? Of course, it's because of capitalism. Even though we spend 70 times lesser, it's because of capitalism. How? Because we have better information, we have better communication, we have better infrastructure, better equipments. And even as medical students, we all know there are other many more medical specialties like gynecology, psychiatry, urology, and virology. What are other indirect factors? Well, better widespread teleeducation. This increases the accessibility of resources regarding health sciences, even amongst rural areas. This in turn results in the increase of students who are willing to enter into the healthcare, causing a high competition in the even higher eligibility standards in the healthcare system. This would definitely increase the standards of the healthcare system. So the healthcare system does improve because of globalization. Second of all, produces more contribution towards the development of public health sectors by research. Research is the biggest thing that has found a big revolution throughout this computer age, through data sciences and all those stuff. So these are all because of globalization. Thus, it's not far from conceivable that globalization is not only positive, but also immensely supportive to the growth of the state-run healthcare system. And also another one that I would like to tell from the opposite team's second reader, the thing is, she told that China actually got it and it's kind of a negative thing for globalization. Actually, the fallacy is appeal to ignorance. We have not proven what's happening in China, or we are not proven scientifically, but they are using that to support their point because none of us know. So that's my argument.
Yeah, so we have heard the arguments of the team. So let's see how the opposing team can come back at their points with the next speaker.
Yeah, am I visible and audible?
Yeah, we can see you and hear you. So you can start once the timer turns green.
All right. Good evening, honorable adjudicators, my dear proposition party, and the audience. So first of all, let me add some points to my our base, which is that globalization has negative impacts running healthcare system. So first, let's talk about finger licking good, KFC, McDonald's, international fast food chains, and also the multinational food companies. They have entered and spread widely in developing countries as a result of globalization, where they introduce products which are more likely to earn profit at the cost of consumers' health, cancers, malnutrition, diabetes. This also puts more patient count on the state-running healthcare system, especially in a country like Sri Lanka, also in the Middle Asian and Southern Asian countries where we depend on the freely available state-running healthcare system. And it's not me telling. According to the Bojan Project, it's a well-known organization which is working towards a global poverty. They mention in India, foreign trade through the multinational companies pave the pathway for increasing the availability of international food production and foreign brand reduced price, but not the quality. And also, because of those products, markets not only negatively affected of local farmers of the country, as well as they have developed a double of burden of diseases on the healthcare system. And the second point, now, throughout the debate, the speakers from the proposition party are talking about Sri Lanka. But this debate topic is not just about the Sri Lanka or the developing countries. Let me talk about America, which is a developed country. Now, we knew in the last COVID pandemic, they lost almost 659,000 people. So with all the development of the medical sector, still they lose. Why they lose? Just look at the Washington Post. This is a very well-known magazine. They mentioned that US healthcare system ranks last among the 11 highest income countries. Because what? The United States has the highest coronavirus death rate out of survived countries after the United Kingdom. For those who can afford it, United States is known for internationally for high quality healthcare. Well, they provide a high quality healthcare for those who can afford. Because of the globalization, nowadays, our healthcare system is more to be privatized. Because of that, in US, we know that a person can't even enter a hospital without a medical insurance. That's why they lost that much of life. And also, let me add more statistics to our second speaker. She mentioned about the brain drain, which is a very common problem here in Sri Lanka. We spend millions on a medical student, and after that, after he graduates, he go to America or Australia, he fly away. Because of that, we are losing lots of assets for state-running medical sector. Now, according to the BMC reports, they mentioned a separate article on the migration of Sri Lankan medical specialists from Sri Lanka. So mentioned in 2013, out of 1,915 specialists who left Sri Lanka, 11% haven't returned in 2013. So it's up to you guys to think what is the condition right now. So let me turn on to the first speaker from the proposition party. She mentioned about now we're getting loans from China. Now it's a good. Is it good, guys? Now we know what is comes in the globalizing world. Nothing comes for free. Everything attached with something in it, right? So she mentioned that we get oxygen cylinders for Corona and all. Did Corona originate from Sri Lanka, from Colombo, Gampa? No, it originated in China. How it came here? Because of the globalization. And she mentioned about the malaria. Where the malaria originated? In Africa. How it came to Sri Lanka? Because of the globalization. Now they're giving us problems and solutions. So I can't say that it's a, kind of a positive impact on the healthcare system. And this turning to second speaker, he was mentioning about children's education, but here we are not to talk about the education. We are talking about the state-running healthcare system, to be precise. So stick to the topic. And also he mentioned how we are learning the Western medical kind of techniques. Now, if you look back at our history, we had a really good Ayurvedic medication system, right? We never want to depend on those countries. But after the invasion of British and all, they came they brought all the diseases. They brought the diseases and they gave us the techniques to heal them. So there's nothing to argue about that. So by that, I can say based on our analysis and also on statistics, we can see that globalization had negative impacts on the state-running healthcare system. Thank you so much.
Yeah, so we have heard some convincing arguments from both sides. So now let's go back to the fourth speaker of the proposition team and see how they can finalize their argument.
Am I visible and audible?
Yeah, you're visible and audible. So you can start when the timer turns green.
A very good evening to all of you. So in this beautiful evening, I'll be starting with a beautiful quote by Prof, one of the greatest authors. He says, globalization is our future. And also, let's go back to the ancient time. You talked a lot about ancient time. Of course, at the ancient time, there were lots of childbirths, and at the ancient time, there were lots of child deliveries taken place at home settings. What was the problem? There were lots of problems, no healthcare precautions. So what is the issue in that? There were lots of consequences. Maternal and infant mortality rates were increased. So let me give you statistics. According to the CDC and World Health Organization, it says that at the beginning of 20th century, it was 1 out of 100 live births when it comes to maternal mortality rates. And it has reduced. They are mentioning that it's because of globalization and within the new technology and the knowledge, it has reduced to 36 out of 100,000 births. And also when it comes to infant mortality rate in the beginning of 20th century, it is 165 out of 1,000, and it has reduced when it comes to 2000, it is 7 out of 1,000. So isn't that a positive effect of globalization? It is a positive effect of globalization. So before that, next I'm gonna talk about something that our positions talked about. And talked about something like globalization. Because of globalization, there are lots of issues how came to the country. No, of course, they're just talking about globalization is a negative thing, but it is not. Let me tell you, what about leprosy? What about hepatitis were taken a long ago? So people died even without knowing the reason.
what about the treatments? Nothing has happened, but people just died. But within globalization, new techniques, new knowledge, and also new diagnostic criteria came into the world, and it was shared. Isn't that a good thing? It is a good thing. And when it comes to vaccines, so one of you said that vaccines were, and also when it comes to vaccines, you're saying that we have to pay for all the things. No, most of the times you do not know. Sometimes China has donated lots of vaccines. And also, why don't you talk about financial and donation supports? Why don't you talk about donations and financial support given to the Sri Lanka? Why don't you talk about those kind of things? Of course, they have given to lots of support. The issue is not in globalization. The problem is actually in the governmental setting. They are not stable. They are stagnating in the same place. And the problem is not in globalization. And also, you talked about sanitizers, those kind of expenses. Of course, again, I'm asking the same thing. What about donations and financial supports? Sometimes you don't even know about them. Not because of globalization. Globalization has given you a positive support. The reason is the governmental setting is not stable. That is the problem. And also, when it comes to herbal medicine, you talked about herbal medicine. And let me tell you, COVID-19 vaccine, it was important. All the healthcare people, and they are supporting the people with COVID-19 because of they are getting vaccine and reduced risk. Because of the vaccine, they have reduced within the risk of getting affected with COVID-19. Why don't you talk about this positive effect? And finally, what I want to say is, let me give you a beautiful example from Sri Lanka, the positive effect of globalization. Honorable Professor Carlo Fonseka has established Department of Disability Studies as Disability Studies in collaboration with United Kingdom, which was a really positive effect within globalization. Until then, no one even knew about persons with disabilities. Do you know healthcare setting? Now there are lots of units and centers being established in state-run healthcare settings because this awareness has spreaded within the globalization. All the good things has came to the world. So finally, what I want to say is globalization is always having a positive impact on state-run healthcare setting. Thank you.
Thank you so much. So yeah, there was a very heated argument. And we can go over to the fourth member of the opposing team so that we can hear their final arguments for the first round.
All right, guys, I hope you can hear me.
Yeah, we can hear you and see you. So you can start when it turns green.
Okay. All right. Well, good evening, everyone. I'd like to start off with a small story. There was once this beautiful island in the Indian Ocean, and all cultures used to live in harmony for over 1,000 years. But then, quite recently, actually, something unpleasant started creeping in, and this culminated in a huge bomb blast, which took the lives of over 250 people and injured over 500 more. The native healthcare system buckled under the sheer number of the injured. And this was a great tragedy. And my point is that we should never forget the root cause of this tragedy. This is imported terrorism, where radical ideas and extremist ideology has slipped in through the back door of globalization and taken a huge toll on our healthcare system and our people. Taking you to a more recent disaster, the foreign ship, the Express Pearl, which caught fire and sunk off our pristine coasts. As you all know, this ship released tons and tons of carcinogens into our oceanic environment. And according to the theories of biomagnification and bioaccumulation, it will accumulate through the food chain until it results, thinking selfishly, as the apex predators, we will have the highest quantity of carcinogens. And as you know, even right now, our scientists are scrambling to try to find the long-term implications of these carcinogens so that our healthcare system can be ready. Like this ship was not a local ship. This ship was a ship which has been, which is not of this country. And so when moving on to my breaking the points, I'd urge my opponent team to consider a key aspect of healthcare, which they seem to have forgotten: the people they are catering to.
they have to remember that whatever affects the people affects the healthcare system as well, right? So, of course, there was a lot of talk about oxygen cylinders and vaccines and, you know, all this help the other countries are doing for us. But, you know, what's the point? It's like someone pushing us into a hole and then offering us a ladder once our leg is broken, right? I mean, there is no point. This virus was definitely not of Sri Lankan origin. Whatever its origins, it is more, the current research has backed it up that this is of Chinese origin. And this is an imported virus. And we have been suffering due to that. And ultimately, they are offering us vaccines as if they are doing us a favor. This is globalization. Nothing comes free. Everything comes with some kind of string attached. Another case in point, as my previous group member has elaborated on, the Russian incident, where Russia exported RT, and we imported the asbestos. And ultimately, the asbestos, which is a highly carcinogenic compound, had to be brought into Sri Lanka just so that Russia will give us our financial aid or whatever they were by buying our tea supplies. Okay. Another point which was very interesting was that my first speaker, our captain, of course, used the word socialism. Of course, this word was never used. This is the proposition speakers trying to twist our words. The term used was socialist welfare state. And I urge you to consider your terminology before attacking, before trying to derail arguments which are very solid. Economic, and as you know, you were wondering why economy and healthcare is not tied together. You have to understand, this is simple. Economical standards are always tied with the healthcare state, with our state healthcare system. That is how it has always been. And that is how it will be. Then considering how infant mortality and how it has improved and such, I'm sure you're aware of formula feeding. And not recently, in the early 1950s, formula started being pushed to mothers to be given to kids. And as a result, kids ended up with diabetes, early onset diabetes, obesity, and so many other things. Like this was this became such a huge deal that countries had to band together and create a summit to, and of course, Sri Lanka had already done this, to ban formula milk being advertised in their countries. And of course, Sri Lanka was the leader, almost the leader in that sense. So my time is up. Thank you very much.
Thank you so much. So we can see that the audience is following this very passionately as well from the number of comments. So now we can go over to the second round, that is the rebuttal speeches. So I invite the captain of the opposition team to start on the rebuttal speech so that they can finalize their argument.
Can you hear me?
Yeah, we can hear you. You can start when you turn screen.
Okay. Now, the opposition team acts as if we said that our policy was of an isolationist policy. It is not. That's what I said in my first speech. We are talking about localization, which means adapting all the foreign policies to our system. Now, they talked about research, right? And this is where localization shines. Like if you look at even guidelines, right? And epidemiology, you can see that what is there for, let's say, European population does not apply to Sri Lanka because we have unique dietary styles, we have unique genetics, which we need to adapt to us. This is why a common policy is not very good. And another thing is about globalization and the concept of global village. This is like keeping, let's say, a cake in the middle of the room and asking a group of 40 to take it, right? So what happens in a free market, which means a place where with no rules is, the strongest people takes the most, which is what's happening in the world right now. If you look at what's happening right now, 8 people, not 8 countries, 8 people now own more wealth than 50% of the world's population, right? 10 years ago, it was 388 people who own 50% of the world's population. Now it's just 8. This is a result of the inequalities propagated by globalization. So, and when we consider again like the pandemic, right? We have now, because of globalization, we have this common enemy, right? But is the response to the COVID common, right? Is the response common? Now, if you go on Google and you look at the vaccine distribution on the world, you'll see that Europe, USA, Canada, and the developed countries have a much higher vaccination rate. But the underdeveloped countries, like let's say Africa, South Asia, have much lower vaccination rate because the stronger people, the stronger countries, the wealthier countries get what they want, and they keep us downtrodden. And like Tavish said, what happens to the people reflects on our healthcare system. For example, companies like Nestle, Fonterra, Coca-Cola, they tried to implement their whatever they want in the countries that they were started in, like US. But when US, one of these facts was researchers promoted by these companies started to say that it's not the diet that influences your obesity, but it's exercise. And then these companies directly promoted exercise while consuming the product. Look at the Milo ads, for example, right? And this is a direct effect of the free market on globalization. This is also reflected, like Milo is in Sri Lanka. In Mexico, it's Coca-Cola. And there's a tail, there's something called a turkey tail, right? This is a delicacy in Samoa. This was brought to Samoa by the US, and because this turkey tail is an anal gland of pure fat, right? And when Samoa tried to ban this, the WTO, the company which sold them, lobbied the WTO, and the WTO and the IMF removed all the funding from Samoa until they restored the imports of turkey tail. This is what's happening to the poor countries. Because of globalization, the rich countries are bullying us. And because of this bullying, this is reflecting on the health of our population. Right now, it's not the communicable diseases that's affecting us. It's the non-communicable diseases which are on a huge rise, right? And like our second speaker said, multi-drug resistant organisms are on the rise, right? And even if Sri Lanka adopts a proper antibiotic guideline, if we adopt proper antibiotic guidelines, if countries like India and China and let's say any other country does not implement them, we can still have imported cases from those countries, resulting in a huge outbreak here. It will be even worse than the coronavirus pandemic, right? And now, this is why we need a system which is unique to Sri Lanka. We need a system which addresses the problems present here and not problems present in the world. Information which we can gather from by working with other countries must be adapted to what is here. That is our base and that is our point. Thank you. And thank you for listening.
Yeah, thank you so much. So now we can move on to the final speaker for the rebuttal speech, the captain of the proposing team, so that they can get the final turn to convince the audience.
Yes, am I audible?
Yeah, we can hear you and we can see you. So you can start once the timer turns green.
Rejection to the base argument of the opposing team. The opposing team have stated a number of inaccurate facts. First, we'll see. They said that the spread of universal brand names of popular beverages and fast foods, but this is not a fault of globalization. These non-communicable diseases are named as lifestyle diseases, which are mainly caused by personal choice. This is a sedentary lifestyle. Are all of us going and using these products? No. then this is a problem which was caused by lifestyle. And you were talking about importing Milo and alcohol. Those are not under our healthcare system. And also, I would like to say, and in the opposition team, they were saying that the migration of health professionals, it's not because of globalization, it's because of the fluctuating systems of the country. As the health professionals, they don't get adequate amount of salary for their hard work, they are moving. It hardly seems ethical to present skilled workers in search of a better life. And that's their own personal choice. And we can't say that is because of globalization. And also, another opposer said about Russia. Russia is not a country which is included even in globalization. Then why are you talking about Russia? And also a person said about USA, said about the mortality rates of USA due to this COVID-19. But do you know, in 1919, the Spanish flu, which attacked USA, gave a mortality rate of 0.64%, but COVID has given only 0.15%. Then what do you think? Now the globalization has come to its utmost level, but in 1919, so do you think is that because of globalization? No. And you all were speaking about pandemics. The pandemics coming, you said that we will be having a pandemic in 10 years after this. But you all should recall that pandemics are not new things for our world. We had pandemics in early ages also. I would like to mention some pandemics like Plague of Justinian and the Antonian Plague and the Black Death. These were caused before 1500 years. But do you think then if these diseases, if these pandemics has occurred at that time, what about the globalization? You are saying that globalization has brought the pandemics, but it was even before the globalization, we have had pandemics. And also, you were saying that we are not talking about globalization and localization. And also, you mentioned that we want to adapt foreign policies to local. That is called globalization. Adapting the foreign policies to local is called globalization. Then, if you need localization and if you don't want globalization, why are you talking about USA, the statistics of USA? And also, you all said about the vaccine matters, only the rich countries get more vaccine and the poorer countries get low amount of vaccine. It's not about inequalities. Something is better than nothing. Even to have a poor access to vaccines can save some life. And for that also, globalization is needed. So you all must understand that point. And globalization has also brought about improvements in research methodology. Clinical research has become more sophisticated as a result. You all said that you all want the research conducted from other countries. You all wanted the data from that, but you all don't want globalization. If globalization is not there, how will you all get the data of the research projects from other countries? Think about that. And also, I would like to say, and also, you all itself said, you are the ones who said you are getting the research data from other countries. But now you are saying that globalization is not needed for us. And also, you were speaking about China. You were speaking that China has given this pandemic to this world, and they are trying to giving vaccines and trying to save other people. Not only China is giving vaccines, all the countries, most of the countries are giving vaccines. They are donating. They have invented vaccines. So you must understand that globalization has a positive impact on this state-run healthcare system. And this is my argument. Thank you.
Thank you so much. So we have witnessed a very heated battle between both the teams.